Hi, my name is Maya Harris, and my Leadership Symposium presentation is entitled Addressing Healthcare Disparities Made Evident by COVID-19, CVS Caremark's Approach. I'll be covering the case study that I wrote on this topic. I'll begin by defining health disparities. So health disparities are defined as preventable differences in health indicators and outcomes that are closely linked with racial, ethnic, social, economic, or environmental disadvantages. Health disparities are driven in large part by social and economic inequities as well as systemic biases. People of color fare worse across a wide range of health measures, including infant mortality, pregnancy-related deaths, prevalence of chronic conditions, overall physical and mental health status, and life expectancy. Many of these disparities have been overlooked, and the COVID-19 pandemic revealed and brought attention to this long-standing societal challenge. So my case study has 4 learning objectives. The first is to understand the impact of racial healthcare disparities in the modern healthcare system. The second is to understand how the COVID-19 pandemic revealed healthcare inequities on a broader scale. The third is to examine ways to combat these disparities in the populations they affect by analyzing CVS Caremark's approach to the issue. And the fourth is to analyze initiatives that can improve health outcomes in these populations from a systemic approach. This graph details different minority populations and how their overall health measures up against their white counterparts. In the orange is where you can see that these certain minority populations fare worse, and as you can see, Black and American Indian populations actually fare the worst. So why are health disparities a national problem? So first, the U.S. spends more on healthcare than any other country in the world, and these costs are significantly on the rise. Healthcare disparities in minorities can result in a lower life expectancy and reduced quality of life. For example, African American women are 67% more likely to die from breast cancer than Caucasian women. And raising public health awareness to focus on prevention before these costly services are needed is one way to bring the national costs down. Community and organization leaders have realized that it's not enough to rely on the government to combat these societal issues. So a lot of health organizations have committed to doing their part to combat these challenges. These disparities have been known, however, they've been widely overlooked until the COVID-19 pandemic hit the U.S. So when that happened, COVID-19 disproportionately affected minority communities, leading to reduced health outcomes and an increased rate of death. When early data came in, it suggested that minorities were 2.7 times more likely to die from COVID-19 than white Americans, most significantly affecting African Americans. The pandemic revealed intersectional vulnerabilities affecting minority populations. The root cause was revealed to be reduced access to quality healthcare services and chronic health conditions. People of color disproportionately suffer from different chronic health conditions such as diabetes, hypertension, cardiovascular disease, and COPD, which are all found to be conditions that led to poor outcomes in COVID-19 patients. This graph shows how people of color had a higher rate of infection, hospitalization, and death due to COVID-19. As you can see, the cases were somewhat higher, but hospitalizations and death were significantly higher amongst minority populations. This research compelled organizations to address the larger health inequity issue in the country, and as the largest pharmacy provider in the U.S., CVS Caremark was one of those organizations. So they had an approach that was pretty head-on. So the first thing that they did was they hired a chief health equity officer to focus on communities of color. Overall, they pledged over $600 million to tackle and combat systemic health inequities in Black and Brown communities. They developed a proprietary system to gather demographic information on their customers. They realized that they did not have the data that was adequate to actually understand where those disparities were. So they did create the system to get the following demographic information: race, ethnicity, chronic health conditions. And this tool also allowed them to geolocate where those disparities were the most significant. They launched a 4-pillar approach. The first was focusing on awareness and education. The second, testing and screening. The third, access to health services. And the fourth, treatment optimization interventions. So part of that, they chose to target specific health conditions affecting minority communities at a disproportionate rate, and those included sickle cell anemia, HIV, and cardiovascular disease. So their initiative started in 2020 and it launched 2021. So where are they at today? So to date, CVS has hosted more than 3,000 health screening events at pharmacies in areas identified as target zones for communities in need. If follow-up care was needed as a result of those screening events, they had nurse practitioners available on site to provide care and consultation to the patients. They also partnered with rideshare company Lyft to provide free transportation to patients in need. And they're collaborating with community organizations and patient advocacy groups to deliver care where the patients are. And they've pledged to measure and share results on an ongoing basis in an effort to provide data sharing. While their approach does seem very thorough, there are some critiques that I have of their approach. So CVS's plan is highly geo-focused and can miss many people in need that are not located in areas with a high concentration of minorities. Their plan also does not focus on controlling the high costs of healthcare. We know from data that that is a major barrier to accessibility to care and prevention in these populations. Also, a long-term plan was not specifically detailed, and a lot of their initiatives did seem short-term in nature. Also, most importantly, in my opinion, is an organizational training program. They don't have one addressed in their 4-part plan, and I believe that it's very important. Training and development should be a continuous task for healthcare employers and organizations. It has been proven to improve overall quality of care and patient outcomes within all populations. And so specifically in minority populations, the benefits of quality, diversity, and equity training in healthcare can include an improvement in cultural competency and literacy, an improvement in employee morale, an improvement in patient-provider communication, an improvement in the quality of care provided to diverse communities, a reduction in health disparities, and a reduction in implicit and explicit systemic biases within organizations and the overall healthcare system. I have 5 discussion questions as it pertains to this case study. So 1, are there any areas of improvement that you would recommend CVS Caremark implement in their health equity plan? Number 2, how can hospital systems use CVS Caremark's strategy to deliver more equitable care to their minority patients? Number 3 is what additional state or federal efforts should be adopted to address health disparities? Number 4, in your opinion, what are the broader implications of health inequities as a society? And number 5, do you believe it is possible to achieve health equity after so many years of systemic biases in the U.S. healthcare system? So, in conclusion, health disparities in minority populations is a major healthcare issue in the U.S. and has a far reaching impact on our society as a whole. CVS has made a significant commitment and has thus far invested a significant amount of money and resources to combating this issue. So, in doing so, they have provided a successful framework for other healthcare organizations to follow.